Welcome to OET Answers.
Your preparation time is over. You can now start your speaking roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Narso Maria, one of the nurses working in this department. Could you please tell me your full name for the record?
Good morning, nurse. My full name is Jane Brown.
Thank you. Jane, please confirm the reason for your visit.
Yes, nurse. I am here to attend an appointment to get information about chemotherapy.
All right. How do you feel about starting chemotherapy?
Nurse, I am feeling really worried about having chemotherapy because this is my first time.
Jane, I can imagine the situation you are going through. Try not to worry about it. Just think this is a treatment procedure. And you will be all right afterwards.
I was leading a normal life. I am trying to realize that, nurse.
That's good. Well, Jane, before proceeding further, tell me what you know about chemotherapy.
The doctor told me the aim of chemotherapy was to reduce the risk of cancer after my bowel operation. This is what I remember.
Okay. What about the duration of the treatment?
No, nurse. I don't remember anything else.
It's okay, Jane. I will explain it to you. Let's first discuss the course of treatment.
Okay, nurse.
Basically, chemotherapy is a 3-week cycle. That means you might get a dose of chemotherapy on the first day and then have 3 weeks of recovery time before repeating the treatment. Each 3 weeks is called the treatment cycle. Is it clear to you?
Yes, it is clear.
Several such cycles make up a course of chemotherapy for your treatment. The total duration of the course is 6 weeks.
Oh, I see.
The chemotherapy drug can be administered at a day clinic. Well, Jane, may I know if you have read the patient information leaflets?
Yes, nurse. I have read the information on chemotherapy that you were given, but I am still unclear on what exactly will happen during the procedure.
It's all right. No worries. I will explain the treatment procedures to you.
That will be of great help, nurse.
All right, Jane. The treatment procedure begins with a blood test before each round of chemo. You will have a blood test called a complete blood count. This is done to get the levels of blood cells that can be affected by chemotherapy.
Oh, I see.
Afterwards, chemotherapy will be performed. The drug is infused into the vein. That is intravenous delivery of chemotherapy. Drugs will be carried out for you.
Okay.
After chemotherapy, your doctor and treatment team will constantly monitor the effectiveness of your treatments. Moreover, you will be provided food and drink after the chemo. If you are not nauseous, you will be provided 6 short meals instead of 3 large meals, but in short intervals. The procedure's duration may vary from hours to hours, depending on the situation.
Okay. I understand that.
Jane, I will make some recommendations to pass the time during the procedure. Some methods you can adopt include reading books and using electronic devices such as music players or video players to make you comfortable.
That sounds good, nurse. It's a good idea to bring something to pass the time. I hadn't thought about that.
Yes, Jane. Now, I would like to bring your attention to some of the common side effects of chemotherapy. After the procedure, you may experience nausea and fatigue. There is a lot of chance of losing your appetite and taste as well. Try not to bother about it too much. This will fade away sooner.
Okay, nurse. I know about the side effects, but I was concerned that they might be quite serious.
I appreciate your thoughtfulness. More importantly, reactions to chemotherapy are different for each individual. There are several reasons for the reactions. It depends on factors like the medication, treatment duration, level of fitness, and so on.
Oh, okay.
Don't panic. Hearing the same, I can reassure you that we will be here to help you. Assistance available for your condition includes medication for symptom relief and helpline numbers to clarify concerns or to get advice.
All right.
I would also like to remind you to arrange transport after the sessions. It is because, after the procedure, you are not allowed to drive. May I know? Is there anyone to accompany you back home?
Yes, nurse. My brother will be picking me up after the procedure.
That's perfect. Do I have to address any more concerns?
No, nurse. I am now feeling more informed and prepared for my first session of chemotherapy.
That's great. I wish you all the very best, Jane.
Thank you, nurse. That is the end of your speaking role play. All the very best.
Thank you.